Welcome back, champions of medicine. Today we are diving into pancreas, a small organ, but it has got huge step on relevance. Whether it's acute inflammation, chronic damage, or cancer, the pancreas packs plenty of high yield punches. Let's kick off with acute pancreatitis. The two big causes here are gallstones and alcohol. When the pancreas gets irritated, digestive enzymes like amylase and lipase activate inside the pancreas instead of the intestine, leading to autodigestion. Patients present with severe epigastric pain radiating to the back, nausea and vomiting. Labs will show elevated amylase and lipase is more specific. Complications can be very serious. Pancreatic pseudocyst, and this is very important for exam. Okay. And then also necrosis, hemorrhage, and systemic effects like acute respiratory distress syndrome. Again, damn important. And don't forget hypocalcemia. And this can occur as calcium binds to fat necrosis in the inflamed pancreas. The next is chronic pancreatitis. And long-term alcohol use is a top cause in adults. Repeated injury here leads to fibrosis and calcifications, which you can spot on the imaging actually. Clinically, patients develop chronic epigastric pain steatorrhea due to fat malabsorption and eventually diabetes mellitus when the islet cells burn out. Chronic pancreatitis increases risk for pancreatic cancer. Speaking of which, let's talk about pancreatic adenocarcinoma. It's one of the deadliest cancers because symptoms usually shows up late. The risk factors are smoking, chronic pancreatitis, diabetes, and older age. Can I repeat? Smoking, chronic pancreatitis, diabetes, and older age. And this is very important points. And classic signs include painless jaundice, weight loss, and Courvoisier sign, which is a palpable non-tender gallbladder. Why? Why is that? Because the tumors in the pancreatic head compresses the bile ducts without causing inflammation. Also be alert for the new onset diabetes in elderly patient, and that can be a red flag for pancreatic cancer. The tumor marker here is CA19-9, but remember diagnosis often relies on imaging like CT or MRI showing a mass in the pancreas. Alright, let's recap. Acute pancreatitis for gallstones and alcohol, elevated amylase and lipase, pain radiating to the back. The next is chronic pancreatitis for repeated inflammation leading to fibrosis, calcifications and diabetes. Pancreatic adenocarcinoma, remember painless jaundice, weight loss and Courvoisier sign and elevated CA19-9. Amazing, you have just wrapped up the entire GI system from the mouth to the pancreas. You now have the high yield knowledge to tackle any step on question that comes your way. Keep this momentum going. You are not just preparing for an exam, you are preparing for the moments when your knowledge will save lives. You have got this. I'm Dr. Ram here from MedMadness. See you next podcast.